Welcome to the deep dive. We take complex stuff and really try to boil it down for you.
Get to the core of it.
Exactly. And today, well, it's a fascinating physiological puzzle, really quite critical.
It is.
Our source material today is this document called Oxygen Supplementation Effects.
Right.
And we're going laser focused on just one question from it, a very precise question.
Which is?
It asks, why does high oxygen supplementation lead to CO2 retention in COPD patients?
Yeah, and that's a hugely important question clinically because, you'd think more oxygen. Good thing, right?
Always good, yeah. Life-sustaining.
But here, for these specific patients, giving too much can actually cause another serious problem.
Retaining CO2.
Exactly. So understanding why that happens, well, it's vital for safe patient care.
Yeah.
Especially with COPD, chronic obstructive pulmonary disease.
Right. And just to be clear for everyone listening, we're not doing, the full rundown on COPD today.
No, not the whole disease state.
We're really zeroing in on this specific interaction. It's known to happen high oxygen CO2 buildup.
A known phenomenon.
But maybe we should quickly clarify just what does CO2 retention actually mean in the body?
Good point. So CO2 retention basically means you have an abnormal buildup of carbon dioxide in your blood.
Which your lungs normally get rid of?
Right. Very efficiently.
Yeah.
Every breath out, CO2 goes. But if you have something like COPD, your lungs, they might be damaged, less effective at that gas exchange.
So CO2 starts to creep up.
It can. And if it builds up too much, you can get problems like respiratory acidosis, which sounds technical, but basically it can mess with brain function.
Seriously impair it.
Yeah. And in really bad cases, it can even be, life-threatening if you don't catch it and manage it.
Which brings us right back to the source's question. It's not just that it happens, but why?
The mechanism. What's going on under the hood?
Exactly. What are the physiological reasons? So, okay, let's get into the first big piece. This idea that giving more oxygen might actually kind of slow down breathing in some people.
Yeah, that sounds backwards, doesn't it?
It really does.
Okay, so this gets into something called the hypoxic drive. For most of us, right, the main signal telling our brain to take a breath is rising carbon dioxide. CO2 goes up, breathes more.
The normal trigger.
The normal trigger.
Yep.
But for some people with severe long-term COPD, their body's kind of gotten used to having high CO2 levels all the time.
Chronically high.
Yeah. So their brain's respiratory center, it sort of recalibrates. It starts relying more on low oxygen levels as the main signal to breathe.
Ah, so low oxygen becomes the alarm bell, not high CO2.
Precisely. It's like their primary alarm system changed. So now, if you come along and give them lots of high flow oxygen,
You turn off the alarm.
you silence that low oxygen alarm.
Right.
What happens? Their overall drive to breathe can actually decrease.
They breathe less often, or maybe not as deeply.
Could be either or both. And if you're breathing less, well, you're not blowing off CO2 as efficiently.
So it builds up.
Retention, leading to retention. That's mechanism number one, a change in the fundamental drive to breathe for that subset of patients.
Fascinating. Okay, so the very help we're giving messes with their breathing trigger. That's one. What about the blood itself, the chemistry? I think I read something about the Haldane effect.
Ah, yes, the Haldane effect.
Yeah.
Absolutely key here. Another piece of the puzzle.
Okay, what's that?
So, hemoglobin, the protein in red blood cells,
It carries oxygen.
carries oxygen primarily, but it also helps transport carbon dioxide back to the lungs.
Yeah.
Now, the thing is, hemoglobin that isn't carrying oxygen, the oxygenated hemoglobin, it's actually better at picking up CO2.
Okay.
It has a higher affinity for CO2 when it's not loaded up with oxygen. So think about our COPD patient getting high oxygen.
Their hemoglobin gets loaded up with O2, more saturated.
Exactly, more oxygenated hemoglobin.
Yeah.
And because of the Haldane effect, that means the blood's overall capacity to carry CO2 actually goes down.
Wow, so loading up oxygen kind of kicks the CO2 off the hemoglobin bus.
That's a decent way to put it, yeah. Less CO2 binds to hemoglobin, so where does it go? More of it ends up just dissolved in the blood plasma.
Contributing to the higher CO2 level. Retention again.
Contributing to retention again. So it's not just the breathing drive, it's also the blood's carrying capacity.
Incredible. Two big mechanisms. Is there a third? Anything happening like right in the lungs?
There is, yeah. This involves something we call ventilation-perfusion mismatch, or VQ mismatch for
It's
short.
a VQ mismatch. Okay.
Right. So in healthy lungs, you want a good match. You want the air coming in, that's ventilation, the V, to match up well with the blood flow going past the air sacs, that's perfusion, the Q.
Makes sense. Air meets blood efficiently.
Correct. But in COPD, because of, damaged airways or air sacs, some parts of the lung might not get much air. They're poorly ventilated.
Okay. dead zones, almost.
Sort of.
Yeah.
Now, the body usually has a smart little trick. In those poorly ventilated areas where there isn't much oxygen, the blood vessels naturally constrict.
Oh.
It's called hypoxic pulmonary vasoconstriction. It redirects blood away from those bad areas and sends it towards the lung areas that are getting air. It tries to optimize the matching.
Smart adaptation. Don't waste blood flow on areas with no fresh air.
Exactly. But here comes the high oxygen again.
What does it do?
That high concentration of oxygen can actually override that protective vasoconstriction. It makes the blood vessels in those poorly ventilated areas open up again. Relax.
So now you've got blood flowing to parts of the lung that aren't getting good air.
Precisely. You're increasing blood flow, perfusion,
Yeah.
to areas with poor ventilation. That makes the VQ mismatch worse.
And that means less efficient gas exchange overall.
Less efficient CO2 removal from the body, contributing yet again to retention.
So it's like a triple whammy.
It really is.
You potentially reduce the drive to breathe.
Yep, the hypoxic drive effect.
You reduce the blood's ability to carry CO2 away.
The Haldane effect.
And you mess up the matching of air and blood flow within the lungs themselves.
Worsening VQ mismatch. It's all three potentially contributing.
Man, that really shows just how complex and interconnected the body is.
It absolutely does. You think you're doing one simple thing, giving oxygen, but it ripples through the system in these unexpected ways.
Yeah.
And that's why, for doctors and nurses, understanding these specific reasons, hypoxic drive, Haldane, VQ mismatch, it's not just academic.
No, it's practical.
It's incredibly practical. It tells you why you have to be careful with oxygen in these patients, why you need to titrate it carefully, give just enough to keep oxygen levels safe, but not so much that you trigger significant CO2 retention.
Right. It avoids those unintended consequences. Better, safer care.
Directly translates to safer care and hopefully better outcomes.
So, okay, we really dove deep into that single question from the source, oxygen supplementation effects.
We did.
Why does high oxygen lead to CO2 retention and COPD? And the answer isn't simple. It's this interplay of different physiological factors.
Which really underlines, I think, just how valuable asking very specific questions can be.
Yeah.
I mean, in any complex field, right? Medicine, sure, but engineering, policy, whatever, it's drilling down past the observation this happens to the mechanism why does this happen that leads to real understanding.
And safer, better approaches.
Definitely. That deeper understanding is what allows us to refine what we do and avoid potential pitfalls.
Okay, so here's something for you, the listener, to maybe mull over. Think about other things, maybe in your own life or just areas you're interested in. Are there other seemingly simple actions or interventions where maybe, just maybe, there are hidden complexities, unexpected side effects?
Yeah, where things aren't quite as straightforward as they first appear.
Exactly. Are there hidden why questions lurking beneath the surface that maybe haven't been as precisely enough? Thinking about those underlying mechanisms? Well, that's where real insight often comes from.
Keep asking why.
Keep asking why, stay curious.